In Nigeria, out-of-pocket payments account for over 70% of all health expenditure, creating a critical barrier to care for the poor. This situation has increasingly made it impossible for the poor to have access to quality and affordable health care. The story of Mariamu Musa, a farmer in a rural Kuje community in Abuja, is not different from the everyday healthcare challenges of the average Nigerian. Mariamu and her husband, also a farmer, have a joint monthly income of about 20,000 naira, and providing for their health needs and that of their two kids is a big strain on their meager income.
Life is tough. When my children get ill, I have to borrow money to take them to a chemist. When I don't have someone to borrow from, we just hope on God. My husband is also a farmer, and what we get from our farm is barely enough to provide for our family.
It is to lift the crushing financial burden on citizens like Mariamu that the United States Agency for International Development, Health, Finance and Governance in the last couple of years has been supporting Nigeria's efforts towards universal health coverage.
We've worked with state ministries of health to gather the evidence required to build a strong case for investing in health. We've worked with the state legislatures, so for example through the Legislative Network for UHC, to help them understand their role and what they can do to support increased domestic resource mobilization for health in order to achieve UHC. We've worked with the media to educate them in understanding what the health financing gaps are, the types of things that legislators and governments and ministries of health should be held accountable for doing in order to move us closer to UHC. And then finally, we've provided a lot of the technical capacity building to state ministries of health to enable them to set up health financing units, to set up state health insurance agencies.
With the poor coverage of the National Health Insurance Scheme after over a decade, many state governments are vigorously pursuing state insurance schemes of their own to fill the coverage gap.
The policy direction of the government is to decentralize health insurance in Nigeria, so that states will set up their own health insurance scheme so that they'll be able to enroll more and more people will be covered under the health insurance scheme. So to get this done, we help them to put in necessary legal framework in place, to review the legal framework and make sure we support the lawmaker to pass the framework, to encourage the government to put right people in the agency, the head of the agency, another full complement of staff that will be working in the agency and build their capacity, give them the necessary training. Then to give them the necessary technical document that will be working with to help them develop the benefit package, to do actuarial analysis so that we'll be able to know what is the premium that people are going to pay to do the health insurance, and to put necessary quality assurance system in place so that people are, when they are assessing care, they are assessing quality care.
This is one partner that's been with us and has delivered at least 5 key interventions even before this continuous plan. They have assisted the state in establishing health finance unit. They are the ones that have assisted us constitute our health finance technical working group. They have helped us review this law, this what you said, Health Contribution Agency law, because as it was passed in the House of Assembly, we discovered a lot of loopholes. We had to retrieve the law and together with Health Finance Group work on it to make it universally acceptable.
In July 2017, with HFG leading the way, the National Assembly, in collaboration with Federal Ministry of Health, convened the first ever summit of the Legislative Network for Universal Health Coverage in Nigeria. The summit brought together 100 legislators from across 36 states of the Federation to work towards increasing financing appropriations to the health sector, ensuring prompt and adequate release of allocated funds, timely passage of relevant health laws, enhancing sustained learning among lawmakers, and strengthening the oversight and accountability functions of lawmakers to review the quality, responsiveness, and efficiency of state-implemented health projects.
We create the interface between the health sector and the lawmakers so that we are able to leverage the statutory role of the lawmakers, which include appropriation, accountability, oversight, and representation. This statutory role have implication for improved financing.
Engaging the legislature and helping the legislature understand their role in domestic resource mobilization, because they play a critical role in deciding where a state's resources go. It means that the Ministry of Health has more people on its side when it's talking to Ministry of Economic Planning or when it's asking for more budgetary allocation.
Many of the programs exclude legislators, but for the first time this program has now invited legislators to engage them, to inform them, and also to get their input in making health available for all in Nigeria.
I feel that this particular parley here and the fact that the state speakers have committed and the two houses and the executive is also here is going to carry that type of best practice model to the whole country, and that's what we call a demographic dividend, and that is what we need.
From one-on-one interface with state chief executives to capacity building workshops for health workers, HFG is not leaving out any sector critical to achieving the universal health coverage objective in its strategic engagement and advocacy.
We work in up to 12 states. Down south, we work in Lagos, we work in Cross River, we work in Rivers, we work in Akwa Ibom State, we work in Osun State. And then up north, we work in Kebbi State, we work in Sokoto, we work in Bauchi, we work in, we support the FCT as well, Nasarawa and Benue State. Though the states are at different stages towards, kickstarting the health insurance work. But I'll give you a specific example of Cross River State, where we've been able to nurture the process from development of the legal framework, capacity building, setting up the institution, to the extent where the governor officially launched the scheme and where the enrollment process has started.
This strategic collaboration is fast turning a once bleak future for universal health coverage in Nigeria to a hopeful and realizable future, as captured by Governor Ben Ayade of Cross River State.
I'd like to thank you for all the technical support, for all the financial support, for your emotional support, for your intellectual support, for all the commitment. Thank you very much.